Good morning. Today's class is on health education, learning outcomes. At the end of the topic, students should be able to define oral health education, its objectives and contents, explain the different approaches of health, illustrate the models of health education, demonstrate types of communication and various aids used in health education. Coming to definition of health education. Health education is the process that informs, motivates, and helps people to adapt and maintain healthy practices and lifestyles, advocates environmental changes as needed to facilitate this goal, and conducts professional training and research to the same end. The Declaration of Alma Ata in 1978 defined that a process aimed at encouraging people to want to be healthy, to know how to stay healthy, to do what they can individually and collectively to maintain the health, and to seek help when needed. Modern concepts of health education emphasize on health behavior and related action of people. That's what we discussed in our previous class. Like health is not only caused from the bacteria or virus, it might be cause of social factor, environmental factor. So collectively, if you modify all the unhealthy behavior, then we can achieve a good health. Coming to the objectives of health education, Alma-Ata Declaration adopted in 1978 provided a useful basis for formulating the aims and objectives of health education, which may be stated as below: to encourage people to adapt, sustain health promoting lifestyle and practices, to promote the proper use of health services available to them, to arouse interest, provide new knowledge, improve skills, and change attitudes in making rational decisions to solve their own problem. Then to stimulate individual and community self-reliance and participation to achieve health development through individual and community involvement at every step from identifying problem to solving the problem. Coming to the role of healthcare providers. The role of healthcare providers in this regard comprise to provide opportunities for the people to learn how to identify, analyze, and health related problem, and how to set their own targets and priorities. Make health and health related information easily accessible to community. Indicate to the people alternative solutions for the solving health and health related problem they have identified. Then people must have access to proven preventive measures. Approaches to health education. First is regulatory approach. In the example, I have stated compulsory wearing helmets during bicycle riding and prohibition of alcohol. Why the government has made compulsory wearing helmets? Because whenever a person met with an accident, he has to protect his body parts. So forcefully government is insisting to prevent the trauma caused from accident. So this is a regulatory approach. Someone is inducing you to protect yourself by doing some act, that is regulations. The next is service approach. It's aimed at providing all the health services needed by the people at their doorsteps on the assumption that people would use them to improve their own health. Service approach. For example, in the rural area, if somebody is having fever, then he can go and approach to the primary health center. There you will get the health service for him. So that is service approach. Then comes your health education approach. Actually, this is cheapest way and most efficient way if you use it properly. In this, it's a general belief in Western democracies that people will be better off if they have autonomy over their own lives, including health affairs, on which an informed person should be able to make decisions to protect his own health. These are the higher goals of health education. Primary healthcare approach. This is radically new approach starting from the people with their full participation and active involvement in the planning and delivery of health services based on principles of primary healthcare. Community involvement and intersectoral coordination, the underlying objective is to help individual to become self-reliant in matters of health. This is nothing but keep your health in your hand. Then what is the difference between a health education and a propaganda? Coming to the first part, the health education. Knowledge and skills are actively acquired in case of health education, but in propaganda, knowledge instilled in the minds of the people. In health education, makes people think for themselves, but in propaganda, prevents thinking by ready-made slogans. Here, it's an act. Here, it's just belief, like somebody is telling and you are listening. In health education, disciplines primitive desires. In propaganda, arouses primitive desires. In health education, appeals to reasons. In propaganda, appeals to emotions. It's like politicians giving the pseudo commitment for your desire. That is propaganda. But health education is not like that. If you follow proper steps, definitely you will have some benefit from the health education matter, but not in case of propaganda. Develops individual personality and self-expression in case of health education, but in propaganda develops a standard pattern of attitude and behavior. In case of health education, knowledge is acquired through self-reliant activity. In propaganda, knowledge is spoon-fed. In health education, process is behavioral centered. In propaganda, process is information centered. In health education, develops reflective behavior. In propaganda, develops reflexive behavior. Reflective and reflexive. Coming to the models of health education, first is medical model. The assumption was that people would act on the information supplied by the health professionals to improve their health. In this model, social, cultural, and psychological factors were thought to be little or no important. The medical model did not bridge the gap between the knowledge and behavior. Then comes the motivational model. Here you can see the ladder, like from the unawareness. If you create awareness, then there will be an interest in the people, then you can evaluate and you can trial run, then you can adapt. This is for the not for the healthcare provider, for the people. So first is creating awareness. In health education, we must first create awareness of health needs and problems through the program of public health. For example, you can tell any people that if you are not brushing properly, then you may end up in dental caries or periodontal disease. So first you have to create the awareness. If you are not practicing healthy practices, then you will be end up in such kind of disease. So here I have shown enlightening, that is creating awareness. Then comes the motivation. Motivation includes the stages of interest, evaluation, and decision making. The individual evinces interest in this subject, he may seek more detailed information about the usefulness, limitations, or applicability of the new idea or practice. Motivation. Then comes your adoption. The new idea acquired, a behavioral becomes part of his own existing value. This is called internalization. Whatever you learned, you will be practicing. For example, you know how to drive. If I give you a car, you will subconsciously start driving. That is internalization. You will be speaking to someone else in your phone and you can drive easily. So that is nothing but adaptation. So if you create an awareness and motivate the people, then they will adapt, and that adaptation will be internalized. Coming to social intervention model, the the motivational model ignored that fact that in number of situations it is not the individual who needs to be changed, but the social environment, which shapes the behavior of individual and community. For example, uh, in my surrounding, many people are smoking due to peer. Yeah, like I will also start smoking. So if the environment is good and others are also practicing the healthy practices, then that will impact positive on the people. So its change of environment will always bring healthy behavioral practice to the people. It is often found that people will not readily accept and try something new or novel until it has been legitimated or it's credible by the group to which they belong. If some, for example, if my grandfather is smoking, uh, like other family members, like my dad or my son or myself, will start practicing smoking. So if my grandfather tells that is not good for health, don't smoke, then there may be chances of uh, the smoking activity will be very limited in the family. Contents of the health education: first is human biology, second is your nutrition, third is hygiene, fourth is family health, disease prevention, mental health, followed by prevention of accidents, then use of health services. So these are the contents of health education. For example, in your first year you have learned human anatomy, that is biology, then biochemistry, that is nutrition, then hygiene, that is prevention, family health, disease prevention control, mental health, prevention of accidents, and use of health services. So principles of health education. First is credibility. It is the degree to which the message to be communicated is perceived as trustworthy by the receiver. Good health education is based on the facts. That means it must be consistent and compatible with the scientific knowledge and also with the local culture, educational system, and social goals. Whatever you teach, it should have authenticated reference and it should be credible. That's what this principle tells. Then comes your interest. It's a psychological principle that people are unlikely to listen to those things which are not to their interest. If a health program is based on the felt needs, people will gladly participate in the program, and only then it will be people's program. First you have to create interest, then only they will start practicing whatever you have thought. Then participation. When they get interest, then definitely they will participate. The health education should be aimed at encouraging people to work actively with the health workers and others in identifying their own health problem and also in developing solution and plans to work them out. Then comes your motivation. In every person, there is a fundamental desire to learn. Awakening this desire is called motivation. There are two types of motivation: primary motives and secondary motives. And the primary motives are driving forces initiating people into action. These motivates are inborn desires. Secondary motivates are based on desires created by outside forces or incentives like love or rivalry. Then comes your comprehension. Whatever you teach in the health education, we must know the level of understanding of the education and literacy of the people to whom you are teaching. For example, you went to rural area and you are telling that you install this app, you will get this benefit or some things will be shown in that app. They don't have phones in the rural area, they don't have proper internet connection, and you are expecting them to watch this app. I don't know whether they will be knowing that app with like Android phone is there, in that some apps are there. Don't know whether they know or not. So you should adapt to their environment and you have to speak to them according to their knowledge of understanding, not your knowledge. Then comes your reinforcement. Few people can learn all that in new in a single shot, but some people wants repetition. So if there is no reinforcement, there is a very possibility of individual going back to their pre-awareness stage. So you have to reinforce day by day or again and again. Then comes your learning by doing. Learning is an action process, not a memorizing one in the narrow sense. The Chinese proverb, if I hear, I forget. If I see, I remember. If I do, I know, illustrate the importance of learning by doing. Known to unknown. In health education work, we must proceed from the center to the abstract, from the particular to general, from the simple to the more complicated, from easy to more difficult, and from known to unknown. These are the rules in teaching. We start where the people are, and with that they understand, and then proceed to new knowledge. I think no need of explanation for this. You should give them example what they know. From there you have to take them to unknown things. So setting an example. The health educator should set good examples in the things he is teaching. If he is explaining hazards of smoking, he will not be very successful if he himself smokes. He should be a genuine health educator. Good human relationship. Sharing information, ideas, and feeling happens most easily between the people who have a good relationship. Building good relationship with the people goes hand in hand with the developing communication skills. For example, if I go and speak with you people and I am following all the healthy practices and you have very much respect towards me, then you will listen to me. So health educator role is to be a good human and responsible person. So feedback. Feedback is one of the key concepts of the system approach. The health educator can modify the elements of the system in the light of feedback from his audience. For example, if you give feedbacks like my voice is not audible, or my sentence framing is not good, or my English is not good, so I will get the feedback and I will try myself to correct. So feedback is always important. Leaders. Psychologists have shown and established that we learn best from the people whom we respect and regard. For example, if I tell you may or may not listen to me, but if your father or your prime minister or any political person tells, means you will be able to practice or you will import the healthy behaviors from the person who is a leader. Then comes practice of health education. Education material should be designed to focus attention, to provide new knowledge, to facilitate interpersonal group discussion, and to reinforce or clarify prior knowledge and behavior. There are audio-visual aids, only audio aids like radio, tape recorder, microphones. Then visual aids, not requiring projections like chalkboard, leaflet, poster, charts. Then requiring projections like slides, film strips. Then combined audiovisual, that is television, sound film. Actually, these are all very old method. The present is your Telegram, your Instagram, Facebook. Actually, this book they have written 10 years back, so they have stated these are the health education methods. But now it's changing. You can use social media. So health education, coming to health communication. Health communication is through the individual approach, like going individually to a person and educating him, then the group approach, then the mass approach. In the individual approach, the personal contact, home visit, personal letters. In the group approach, lectures, demonstration, discussion methods, group discussion, panel discussion, symposium, workshop, seminar, role play. In the mass approach, television, radio, your social media, everything will come. So individual approach. It may be given in personal interviews, in the consultation room of the doctor, or in the health center, or in the homes of the people. The individual comes to the doctor or health center because of illness. Opportunities is taken in educating him on matters of interest like diet, causation and nature of illness, and its prevention and personal hygiene, environmental hygiene, etc. The biggest advantage of individual health teaching is that we can discuss, argue, or persuade the individual to change his behavior. It provides opportunity to ask in terms of specific interest. The limitation of individual health teaching is that the numbers we reach are small and the health education is given only to those who come in contact with us. But this is very effective but not feasible, or it is very time consuming. Coming to the group approach, our society contains groups of mankind like school children, mothers, industrial workers, patients. Group teaching is an effective way of educating the community. The choice of subject in the group health teaching is very important. It must be related directly to the interest of the group. For example, we should not broach the subject of tuberculosis control to a mother who has come for delivery. We should talk to her about the childbirth and baby care. Chalk and talk. The lecture may be defined as carefully prepared oral presentation of facts, organized thoughts, and ideas by the qualified person. The chalk lends the visual component. The chalk and talk communication has still a very important place in small group education. Its effectiveness depends to large extent on the speaker's ability to write legibly and to draw with the chalk on a blackboard. The talk should be based on a topic of current interest or health needs of the group. The group should not be more than 30 and the talk should not exceed 15 to 20 minutes. If the talk is too long, people may become bored or restlessness or they might sleep. That's what happening when you listen to some lectures, maybe mine also. The lecture method can be made more effective by combining with suitable audiovisual aids, such as flip charts. They consist of series of charts about 25 by 30 centimeter or more, each with an illustration pertaining to the talk to be given. They are meant to be shown one after another. Each chart is flashed or displayed before group as the talk is being given. The message on the charts must be brief and to the point. These charts are primarily designed to hold attention of the group and help the lecture to proceed. This is one of the chart showing the roots and crown portion. Like once it get removed, how the bones will be visible, like that. There should be some flip chart to educate the flannel graph. A piece of rough flannel fixed over a wooden board provides an excellent background for displaying cutout pictures, graphs, drawings, and other illustrations. Flannel graph offers the advantage that pre-arranged sequence of pictures displayed one after another helps maintain continuity and adds much to the presentation. Exhibits like exhibition, the objects, models, specimens convey a specific message to the viewer. They are essentially mass media of communication which can also be used in group teaching. Then comes your film and charts. like in your, we are telling you to prepare some videos which are having public health importance. So those things will come in films and charts. But you have to involve all the principles of health education to prepare an health educational video. Demonstration. Demonstration is a carefully prepared presentation show how to perform the skill procedures. Dramatize by arousing interest, persuade the onlookers to adopt recommended practices, upholds the principles of seeing in believing and learning by doing, can bring desirable changes in the behavioral pertaining to the use of new practice. Demonstration as a means of communication has been found to have high educational value in programs like environmental, sanitation, mother and child health, and controlled diseases. The clinical teachings in hospital is based on the demonstration. This method has a high motivational value. Come to group discussion. Group discussion is aggregation of people interacting in a face-to-face situation. This contrasts sharply to the group of students in a classroom situation. For example, it permits the individual to learn by freely exchanging their knowledge, ideas, and opinions. For effective group discussion, the group should comprise not less than 6 and not more than 12 members. The participants are all seated in a circle so that each is fully visible to all others. There should be group leader who initiates the subjects, help the discussion in proper manner, prevent side conversation, encourages everyone to participate, and sums up the discussion in the end. The major disadvantage of the group discussion is, for example, there are 6 persons, in that 2 are very active, other 4 are not active, means they won't listen. So that is the major disadvantage. But overall, it is a good method in inducing any health education matter. So that's what I explained you, like in the group discussion, not without limitation, everything have its own limitation. In this, like some people may shy and they don't want to express themselves, and some are dominating. So this you have to, like moderator has to control the discussion. And panel discussion. There are, like here in the picture you can see there are 4 people and they are the panel discussers. Then these are the audience. The panel comprises chairman or moderator and from 4 to 8 speakers. The chairman opens the meeting, welcomes the group, and introduces the panel speakers. He introduces the topic briefly and invites the panel speakers to present their points of view. There is no specific agenda, no order of speaking, and no set speeches. The success of the panel depends upon the chairman. He has to keep the discussion going and develop the train of thought. After the main aspects of the subject are explored by the panel speakers, the audience is invited to take part. Panel discussion can be extremely effective method of education provided it is properly planned and guided. Coming to symposium. Symposium is a series of speeches on a selected subject. Each person or expert presents on aspects of the subject briefly. This is like your TED Talk. One person will be speaking and audience will be listening. There is no discussion among the symposium members. Like in panel discussion, in the end, the audience may raise questions. The chairman makes a comprehensive summary at the end of the entire session. Then comes the workshop. The workshop is the name given to novel experiment in the education. It consists of series of meetings, usually 4 or more, with emphasis on individual work within the group with the help of consultants and resource personnel. The workshop provides each participant opportunities to improve his effectiveness as a professional worker. Coming to conference and seminars, this category contains large component of commercialized continuing education. They range from one half day to 1 week in the length and may cover single topic in depth or be broadly comprehensive. They usually use variety of formats to aid the learning process from self-instruction to multimedia. Role-playing. Role-playing or social drama is based on the assumption that many values in situation cannot be expressed in words. and communication can be more effective if the situation is dramatized by the group. For example, if I am acting and showing that how dental caries is causing, what discomfort it will be when the dental caries involves the pulp. Like I'm showing, oh, I have a lot of pain in my tooth, like that. The role playing I can make to create awareness in the people. Then comes a mass approach. Mass media are one-way communication. They are useful in transmitting messages to the people in remote places. The number of people who are reached usually count in millions. Their effectiveness can give high returns for the time and money involved. Public health methodologies should be culturally appropriate. They should be carefully thought out before use. So lists of mass media. First is television, then radio, internet, newspaper, printed material, then direct mailing, then posters, billboards and signs, and health museum, then folk media. So these are the list of the mass media. Here we can use only audio in case of radio, or both audio and visuals in television, internet. There might be blogs, there might be a website, or there might be a BMI checker, or something like that, body mass index. Online we can check it. Like that we can create some health education matters. Thank you.